Your blood test has finally arrived. You slowly scan the report, expecting everything to look normal, but suddenly, one word catches your attention: creatinine. The number is higher than the normal range. Within seconds, your mind fills with questions. Is something seriously wrong with your kidneys, or could there be another explanation that your report doesn't immediately reveal? Many people immediately assume that a high creatinine result means their kidneys are failing. Others begin searching the internet, finding frightening information that only increases their anxiety. But the truth is much more complicated. A single blood test rarely provides enough information for doctors to diagnose kidney disease or determine how healthy your kidneys really are. Before you panic, it's important to understand what creatinine actually measures, why it can become higher than normal, and what other tests doctors usually check before reaching any conclusion. By the end of this video, you'll understand what your blood test may be telling you and what it may not be telling you. Let's begin with the most important question. What exactly is creatinine, and why does every healthy person have it? Despite what many people believe, creatinine is not a disease, a poison, or a harmful chemical that suddenly appears when your kidneys become weak. It's a completely natural waste product your body produces every single day. In fact, every healthy person has creatinine in their bloodstream because it's a normal part of how your muscles work. After creatinine enters your bloodstream, it travels to your kidneys. Think of your kidneys as your body's natural filtration system. Millions of tiny filters, called nephrons, work around the clock to remove waste products like creatinine, while keeping important nutrients and fluids inside your body where they belong. This is exactly why doctors measure creatinine during a blood test. If your kidneys are filtering blood efficiently, creatinine usually stays within an expected range. But if that number changes, it doesn't automatically mean kidney disease. Doctors also consider your age, muscle mass, hydration, medications, eGFR, urine tests, and overall medical history before understanding what the result may actually mean. So if every healthy person naturally has creatinine, why does the level sometimes become higher than normal? Surprisingly, one of the most common reasons has nothing to do with permanent kidney damage. One of the most common reasons for a temporary increase in creatinine has nothing to do with permanent kidney damage. It's dehydration. When your body doesn't have enough water, the amount of blood reaching your kidneys can decrease. As a result, your kidneys may filter waste less efficiently for a short time, causing creatinine levels to appear higher than expected. This doesn't automatically mean your kidneys are damaged. In many cases, once the body is properly hydrated, blood flow improves and creatinine levels may return closer to their previous range. That's why doctors often ask about recent illness, vomiting, diarrhea, heavy sweating, or low fluid intake before interpreting a blood test. That's also why doctors rarely rely on one blood test alone. If dehydration is suspected, they may recommend repeating the test after you've recovered or improved your fluid intake. Looking at changes over time often provides a much clearer picture than making decisions based on a single creatinine result taken on one particular day. But what if you're drinking plenty of water and your creatinine is still high? The next reason is something millions of people never even think about, and it could be sitting in your medicine cabinet. Sometimes, the reason behind a higher creatinine level isn't your kidneys, it's the medication you're taking. Certain medicines, including some pain relievers, antibiotics, and blood pressure medications, may affect kidney function or temporarily change creatinine levels in some people. This doesn't automatically mean the medicine is harmful, but it does mean your doctor may want to investigate further. For example, if you've recently started a new medication, your doctor may repeat your blood test or review your prescription list before making any conclusions. They may also ask whether you've been taking over-the-counter painkillers regularly, because long-term or inappropriate use can increase the risk of kidney problems in some individuals. Never stop a prescribed medicine without medical advice. This is one reason doctors always ask about your full medical history instead of looking at one laboratory number in isolation. Your age, medications, hydration, blood pressure, diabetes, and other health conditions all help explain why creatinine may be higher than expected. The goal isn't to blame one cause, it's to understand the complete picture before deciding what to do next. So if dehydration and medications aren't responsible, doctors begin looking much more closely at the kidneys themselves. The next test is considered one of the most important measurements of kidney function. Although creatinine is an important blood test, doctors rarely rely on it alone. Instead, they calculate another measurement called eGFR, which stands for Estimated Glomerular Filtration Rate. This calculation uses your creatinine level together with factors like your age and sex to estimate how efficiently your kidneys may be filtering waste from your blood. Think of creatinine as one clue and eGFR as part of the bigger picture. A slightly higher creatinine level may mean something very different in a muscular adult than it does in an older person with other health conditions. That's why doctors interpret these results together instead of focusing on just one number. Even eGFR doesn't answer every question. If your doctor is concerned about your kidney health, they may also recommend urine testing, blood pressure monitoring, repeat blood work, or medical imaging. Looking at all these results together provides a much more accurate understanding of how your kidneys are functioning than relying on any single laboratory value. So if your creatinine comes back high, when should you actually be concerned? The warning signs aren't always obvious, but there are situations where you shouldn't ignore the result. A single high creatinine result doesn't always mean there's an emergency. However, it should never be ignored, especially if the level remains elevated on repeat testing or is accompanied by other abnormal findings. This result is a signal that your kidneys deserve closer attention, and your healthcare provider can determine whether further evaluation is needed. Your doctor may also ask whether you've noticed swelling in your legs or feet, changes in urination, persistent fatigue, loss of appetite, or unusually high blood pressure. These symptoms can have many possible causes, but when they appear together with abnormal kidney tests, they deserve proper medical assessment rather than self-diagnosis. The most important step is not to diagnose yourself based on a single number or internet search. Instead, discuss your results with a qualified healthcare professional who can interpret them in the context of your medical history, physical examination, medications, and any additional tests. That's the safest and most reliable way to understand what your creatinine result really means. The good news is that a high creatinine result doesn't always mean permanent kidney damage. In many cases, the next steps are about protecting your kidneys and addressing the underlying cause, not simply trying to lower one number. If your creatinine is higher than expected, the first step isn't to search for a miracle cure, it's to understand the cause. Your doctor may recommend repeating the blood test, reviewing your medications, checking your blood pressure, and ordering additional tests. Finding the reason behind the result is far more important than trying to lower one number on a laboratory report. Simple daily habits may also help support overall kidney health. Staying well hydrated according to your individual needs, managing blood pressure and diabetes if you have them, avoiding smoking, eating a balanced diet, and taking medications only as directed can all play an important role in protecting your kidneys over time. Most importantly, don't make major health decisions based on social media or internet advice alone. Every person's health situation is different. The best approach is to work with a qualified healthcare professional who understands your complete medical history and can recommend the right tests, treatment, or follow-up plan based on your individual needs. So, after everything we've learned today, what's the one message you should remember every time you see a creatinine result? Let's bring it all together. If there's one lesson to remember from this video, it's this. A high creatinine result is not a diagnosis. It's a signal. It tells your doctor that your kidneys may need a closer look, but it doesn't automatically mean kidney failure. Understanding the cause is always more important than worrying about the number itself. Whether the cause is dehydration, medication, muscle mass, or an underlying kidney condition, the best next step is always the same. Work with a qualified healthcare professional, follow the recommended tests, and make informed decisions based on your complete health picture instead of a single laboratory value. Knowledge is one of the best tools for protecting your health. If this video helped you better understand creatinine and kidney health, subscribe to VitalBites for evidence-based health education every week. And tell us in the comments, have you ever had your creatinine or eGFR checked? Your experience could help someone else learn something important today.